So it looks like there's not the great chords that I need to moderate.
No, well, I think we'll just let them do it today.
Yeah.
You guys can just stream us.
Yeah.
Like usual.
Just like, everyone gets a turn, Travis. No moderating.
So we heard from a few folks that they'd appreciate a fact sheet in advance with the numbers. So we'll get this going around. This is as of this morning, and so as you know, Ontario.ca/corona, if you wanted to pass it down, /coronavirus, we put numbers there every day at 10:30, but for the Monday and Thursday media briefings, we'll bring these more detailed breakdowns. So we have Dr. Williams and Dr. Yaffe today. We have them for 30 minutes. At 5 minutes, I'll give you the 5-minute cue, and I'll let you know when your last question. You will inevitably ignore me, but we'll do it.
I wouldn't do that to you, Travis.
Yeah. Any questions before we get going? They'll be coming from that door.
How many times can we ignore you?
I'm just going to say once.
Okay.
Okay, thanks everyone.
You said wait, you don't have to. Twice in your points.
Okay. Good morning, and welcome to our media update, second one this week. And we hope to bring you up to date on the global situation, the situation here in Ontario. Dr. Yaffe will cover that, and some other aspects that are ongoing at this time. And then have time for questions, and knowing we have to leave after a certain time, and we'll be trying to stick to that as best we can. So the situation continues to evolve globally. You have the numbers. I'll just note them. Today, over 7,812 cases globally. Most of those are in China, of course, in the Hubei province. And other parts have moved from there to other cities. They've been followed. And 170 deaths reported in China. There have been no deaths reported of those who have gone to other countries. That's good news. Asia and Oceania has about 80. Europe, 9. Canada, we have, last time we talked, we had 1 confirmed, 1 presumed confirmed here in Ontario. We have now 2 confirmed, and the 1 confirmed case in British Columbia. So Canada still sits at 3, and the U.S. still sits at 5. And the Middle East has 4. There has been some concern, people say, with what my comments about the numbers. My answer is always that before, when we were having 2,000 or 3,000, I was saying I'm a bit worried because the numbers should be much higher. And I said I expect it to be well over 10,000. When you're dealing with now the adequate testing methods, as they're now getting up to speed in China with their infrastructure, and they're doing a lot more testing of individuals, they're going to find a lot more cases. And that's not but surprising. That gives me reassurance that they're doing going out, case finding, and find those not just the severe ones, moderate, mild. They're going after everybody, and I'll be much more reassured as those numbers continue to go up that their testing methodology, because they're now doing the 30 or 40 a day, they're doing 200, 300, 400, 500 tests a day, because that takes a lot of build up that infrastructure in the laboratory system to handle that. And that's, to me, is encouraging, and it'll give us a better data of population-wide what's happening in their areas, with a population basically of 30 million in that jurisdiction there. I would say on the deaths, and I've heard some people concerned about, they talk about how deadly the virus is and that. I think one has to take that and understand what that means, and we've done this before in our outbreaks. It's very difficult to differentiate whether, especially when dealing with older people who have a lot of comorbidity, if they died solely from the novel coronavirus or they died with the novel coronavirus. Is it the sole cause or is it contributing? I know I've made discussions with our chief coroner. He will say it's very difficult to distinguish that. And most times when we have similar like this, he says, I don't say one or the other, I say with. It contributes to. How much? It's hard to say. We have to be informed on that, those cases. What does that mean? How much do we understand that before we just conclude that is solely due to the virus itself? So I just want to make sure those on those global updates. We'll continue to get those numbers and to look at those. As I said before, and our federal counterparts and my fellow CMOHs across the country, Chief Medical Officer of Health, will continue to look at this and try and get a better sense of the epidemiology, how it's moving and how it's progressing. So that's the global picture. I'm going to ask Dr. Yaffe to talk about the updates of our case of people under investigation here in Ontario for novel coronavirus. So over to you, Dr. Yaffe.
Thanks very much. So I believe you got a fact sheet on the novel coronavirus investigations in Ontario. So as of this morning at 8 a.m., a total of 67 tests have been performed by the Ontario Public Health Lab. Of those, as you know, 2 are now confirmed positive by the National Microbiology Lab. 38 are negative, and 27 are pending results. In terms of the 2 cases, the first one remains in hospital and is in stable condition. The second one remains at home in self-isolation and is feeling well. As well, Public Health has been in contact with all the passengers within 2 to 3 meters of the cases on the plane and informed them that they should be looking for signs and symptoms, and they're being contacted daily for the 14-day period. Health evidence states that these kind of respiratory droplets do not spread more than 2 meters. So, in addition, as you know, the 2 cases were wearing masks for the duration of the flight, which also reduces the risk of transmission of droplets. There have been some individuals that were on the plane, not within 2 or 3 meters of the cases, who have reached out to the local health unit for information and to determine if they should be tested. And what this means is, in all, the system is working. People are receiving and hearing the information about this novel coronavirus and seeking direction from their healthcare providers or the public health unit. Working with the federal and other provincial jurisdictions, the case definition now has been expanded to include travel to Hubei province, which of course includes Wuhan, within the past 14 days, and airport border screening is reflecting this. As well, now we're looking at cough or fever, not both necessarily. With that, I'll turn it back to Dr. Williams.
Thank you, Dr. Yaffe. And on that aspect of the case definition, as I said, we have convened the Special Advisory Committee that is called by the Chief Public Health Officer of Canada, and that is the Chief Medical Officer from all the provinces and territories, meeting with the Chief Public Health Officer of Canada and other officials at Public Health Agency of Canada, Health Canada, Borderland Securities, different people, and this committee meets on a regular basis, up to even daily times or twice a day if needed, as the issue evolves. We had a meeting on Tuesday, we have another one today, and we will be discussing a number of things, including the case definition, whether that will be expanded or changed, because the WHO is meeting today. And, excuse me, we're going to hope to hear from them if there's any changes to that, including any travel issues, but that's a federal jurisdiction, and we're waiting to be advised on that. And that comes from their interaction at the table with the WHO and the international community, and so that filters down to us, and we had those discussions at our Special Advisory Committee. And subcommittees are formed in there to deal with different aspects. And we have a technical advisory committee that deals with this evolving science and issues around there, and we can give you updates on that as that proceeds. Excuse me, of key importance right now, everybody wants to talk about is the whole aspect of repatriation. In there, we were alerted the last meeting that the federal government was looking into the matter. As you've heard, there's been some further discussions. It is their jurisdiction. It's their responsibility. And we hope to get some updates from that during our meetings today to see if and when that might occur and when they're going to choose to do that and how they're going to do that and guide and direct, and then how we would seek to coordinate with our respective provincial and territorial jurisdictions if and when it was necessary, and that all has to be mapped out, and we're hoping to hear some more of that today. Other issues of concern, and we talk about at our meetings with our technical ones, is around transmissibility is the word, and you've heard lots of data, and it's interesting discussions about the R naught and what does that mean. It's a technical term about how it is. As you know, in measles is high, 18 to 20, whereas this one here from our counterparts are talking somewhere between 1.5 to 3. They're landing about 2.5. CDC put it a little bit higher, so it's not definitively known. Everybody's looking at that. So you can see it's not that much different than regular influenza. And now I say with the data coming out of China, with more and more people, general population being tested, they'll probably find a lot more younger people who said, I guess I was sick a few days ago, cough, I guess a little bit for 24, 48 hours, and they get tested, well, I'm positive. And so young people can get it up and seem to throw off the virus fairly quickly. Older ones with problems of immunity have more of a challenge and it stays longer. So it's not the same for everybody. So we have to be informed by that and get some better numbers on that. But it doesn't seem to be as contagious, if you use the term, as some other ones, such as measles. So we have to understand that. The other aspect is that we're talking about close contact. We don't mean casually you walk by the person or the person sitting over there is not the issue. It tends to be very much in a family that has frequent, regular contact for periods of time. In that, see, people have talked about, is it transmitted from asymptomatic? And right now, the evidence we have does not support that. We are looking to hear cases and understand that, including ones reported from other sectors, such as Germany, and we're reviewing the details of all that investigation to understand that better. So the information we have now is that while you could incubate, you're generally not infectious or transmitting until you show some signs of symptoms. That can be, as Dr. Yaffe said, cough and or fever, and early aspects, not the full-blown viral picture of aches and pains and that aspect there. So that still is our case definition, and that's what we're handling at this time. So we see that the only spreading from person to person seems to be close contacts within a family unit and we have seen that evidence. Of course, we're not sure even our case that's in home isolation, they had a travel history and they have a contact history. Which was the significant one? You can't say. So finally, I just want to talk about, and I know that other sectors and Toronto Public Health have done an excellent job, because in these early days, and we experienced this, and I know I was here during SARS, and Dr. Yaffe was here during SARS, sometimes people in times of lack of knowledge, sometimes through fear and apprehension, start to make generalizations and broad assertions, including aspects that sort of move into areas of racism and racial profiling. I think that's, I want to strongly discourage that. As I said all along, individuals who have come back from these areas, this is the key, is the travel history, not people who have not traveled. They have been so thus far very responsible of coming in a timely way and reporting, very particular about their own isolation, very concerned about not putting anyone at hazard, and very concerned about their own health. So there's no irresponsibility in here, very much the opposite. I think when you're looking at certain visual things, such as people who don't wear masks, all I can say is that many of us have our own customs and traditions that we do, and some of our mother makes us do, and it may not have much scientific merit, but we're used to it, and we like to do things like that. And my sense is that we talked about the masks and how it doesn't really prevent, and someone asked the other day, aren't you wearing a mask? I said, I'm not carrying out a surgical procedure right now as a doctor. I'm not doing an operation. But at the same time, I understand if someone feels they want to do that, I guess that's their prerogative. And even if you hear recommendations from China itself, that's what they recommend their citizens do on that basis there. So just because you see that doesn't mean anything, because having been around Toronto for years, I've seen that behavior every winter for years. It's not new. And so I would be very strongly discouraging any commentary on that, and people should be asked to do something different just because someone has the wrong impression due to some visual or issue, and they need to understand better what it is and not jump to those conclusions. So again, those are the main things I want to say at the outset of things that we've been trying to deal with, and I applaud Toronto Public Health and other ones who have tried to increase that knowledge base and understanding of our citizens, because Toronto and our area around here, we're an international community. We're a gateway into the world. We take pride in that. We value the differences we have. We build on differences, and we gain from that. And we only but support that. So we need to understand that and continue to work at that and understand it better. So with that, I'm going to open up for questions, and we have a bit of a timeline, but we'll try and answer your questions as best as possible with these updates and others you may have.
Person-to-person, suspected person-to-person here in Toronto, where one person does not have a travel history. So, for example, if someone was on a flight from China and came back with it, is there any case where they might have someone in their family or someone they know is being tested now who was not in China?
So far, our people on investigation, that means those that have signs or symptoms and have a history of either two things. One, that you were in the areas of concern and travel, or second, that you were in contact with a known case with some level, not just that you saw them across the room. So far, as Dr. Yaffe said, those individuals that were proximal to the people on the plane were processed and discussed with Toronto Public Health. So we haven't had no report to that effect as of this time. But if it needs to be investigated, Toronto Public Health or others that may have, if wherever those people reside, the local public health department will carry out a thorough investigation, monitoring, etc., and testing when and where appropriate. So we haven't had evidence of that in Ontario as of this time.
Could you put some...
Except you may say the wife of the first case, but we don't know because that person also had a travel history.
Yeah, I was discounting that. I just wondered if there was because they were both in China.
So the simple answer is no.
In the first case, did the individual, the first case here in Ontario, did he go to work after he came back from Wuhan?
No. Or work in Canada?
In Canada?
No.
Okay. And then the second question is, out of the pending, the 27 that are pending right now, are any of those from the original 19 under observation still?
I'll speak to that. We don't have those details, but generally the lab test takes 24 hours, 24 to 36 hours. So I'm guessing that probably those 19 have been resolved one way or the other. But they keep coming in, right? So these are probably 27 that have come in the last 2 days, I'm guessing.
Could you put some context into those numbers, the 38 that have been found negative, some analysis, I guess. What does this say to you about the level to which the new coronavirus has spread or not spread within the population?
I think that's a good question. And I think that speaks to the issue that instead of not knowing, we're following everyone who has a history of travel of importance, who has signs or symptoms, and just not waiting. We're testing them. Some have been identified with other seasonal viruses, and some they're all negative, the ones ruled out. That tells us that the people coming back, it's not that you're dealing with highly infected people. Very few are. In fact, so far, we have 2 cases in there out of the 67 thus far. That's not a high rate, especially when these individuals basically were very much exposed in that aspect in their travel. So it makes me think that the R naught we're talking about at this level, the people who coming were already taking some precautions. They were not ill when they came. Was it missed in travel? We find a lot of them were not symptomatic on the flight. They're symptomatic because they're all flying in. Various flights over the last while. And so far we haven't found anyone yet, except this couple who were reported fairly promptly to the system. And I expect we'll see some more, potentially, but it's not like everyone is. Very smaller, getting smaller and smaller percentage as we screen more and more and more people, with not just screen for the sake of screening, but those who have a case definition of travel risk and signs and symptoms.
So if I could just follow up, so what does that say to you about the transmissibility and the extent to which this virus is having an impact in Ontario?
I'm reassured. It would seem to be low. Those are small numbers, but in the early days, if it was already picked up, 7, 8, 9, 10 cases in that, I'd be much more concerned. This is reassuring in a way, but not that we're going to sit back and say we can coast. Let's keep at it. So I think it's reassuring to the citizens of Ontario. One, that the system is working, we're investigating. Individuals of concern have self-reported, are coming forward, and we haven't seen ones that sort of the blue show up already quite ill. And in fact, we're not seeing it yet, but it's still early days.
Is that the key? Because,
Doctor?
sorry, go ahead. Is that the key? Because I remember SARS, it generated when the elderly woman came and died at home, and her son went to the hospital and nobody knew what to look for, and he sat in an emergency room for 24 hours, and 81 other cases were connected to him. You keep stressing that people are more aware and that they're self-reporting and that they're asking questions. Is that the key to combating this, like individual responsibility, and are they so much more educated this time around?
I agree, because viruses are not, it's not like some magical thing. They move by certain strict ways. They're fomites, they go by spread with droplets. So by knowing what it is and what it isn't and your risk factors, you can quite easily prevent in that aspect there. So an informed public is a better public. In an informed healthcare system, it wasn't informed, they didn't know what was going on when the case. And when some say, well, some other parts picked up personal travel history, the index case in SARS did not travel, had never been out of the country. And so that would not pick that up. But they're much more knowledgeable now. The testing wasn't available, didn't even know what they're looking for. And so it's so much different than back then. And that's why I'm saying the same thing with the evolving situation in China. You can't compare what China did back in Hong Kong back in 2003 to what's now. Quite different. Is the challenge big? It is big. Are they dealing with it? They're doing big time things that they never got close to. And they're going at it full tilt and bringing in all sorts of experts. So it just seems, it's very hard to compare the two at all.
If I could just add to that, I think also the way that hospitals operate now and healthcare in general around being more aware of people with febrile respiratory illness and asking travel history and putting them into precautions immediately, those were not in place in SARS. And of course, having a lab test is a real change agent for us. In SARS, we didn't have lab tests. And the symptoms, just like here, are very nonspecific. So it is a totally different situation.
To be clear, are any of the people who were on that plane among those who are under investigation at this time?
There are a small number of people who were on the plane who are being under investigation, but the results are not available yet.
And those may be people in another part of the plane that
Yeah.
have a travel history to Wuhan, because our cases are not the only ones who came, and we would like them to come forward and say, yes, I have a travel history and I'm not feeling well. They would meet our PUI or personal investigation. Not that it has to do with the cases, but they're still concerning if they have that combination.
Are
Yes.
there any other people from other flights who are under investigation, other than this particular China Southern flight?
I mean, everybody who's under investigation must have been on a flight, because part of the part of the case definition is that you have been to Wuhan or Hubei province, so they must have traveled within 14 days.
And came from China. They
From
came
there.
into Canada, so they're all flight related
Yeah.
thus far, because you asked before about any contacts we know inside Canada. No. Yes, sir.
How about if WHO announced that this is a global emergency? Is there the Ontario will be tighten up the public health measurement or doing something more?
Because we're involved in the whole global picture, the WHO in discussion, because our Public Health Agency of Canada, representatives in Health Canada, are at that table. And if in concert with that, they would take directions and try and do it in concert with the rest of the peers around the globe. And so if that changes on the Health Canada situation, Canadian situation, we would do that. Same with Ontario. We would follow suit and put the same things. That's part of why we have the Special Advisory Committee. And then we would modify our case definition as well as our screening methods to a wider venue. But we have to wait to see what the WHO proclaims.
Can I ask you about the repatriation of Canadians in Wuhan? When they arrive here, is it Public Health of Canada that makes a decision about quarantine, or what sort of measures should be taken with those folks, or is it what provincial jurisdiction they end up? Like, I'm just trying to find out what'll be the protocol for those folks as they come in. I'm thinking Australia went through that extreme measure of taking them to Christmas Island to quarantine.
First of all, it's a federal jurisdiction because they are being repatriated. so they're coming back into the country. We would hope that we would be sitting at our special advisory committee. We would look at the various aspects around the logistics. Where would they be coming into? How's the federal government going to handle that? Is there going to be a quarantine period, yes or no? Are they going to do that? If they're going to send them to respective jurisdictions where they reside, how's that going to be handled? How are we going to do it? This all has to be worked out. And most of the time we understand they're not going to be on that one, and we want to clarify, are they repatriating who's ill or only repatriating people who, of course, have travel history, but they may be asymptomatic, and then how are we going to handle that? So we'd like to all agree, all the provinces and territories, such that our up above, our deputies and ministers would say that makes sense, and because it's a collaborative action led by the federal government.
So what makes sense to you? What should happen?
Well, I think we have to be informed. I don't know what the status of these individuals are. I don't know what their exposure rate, if they have been ill at all. I don't know if we're going to do some intake stuff. So I want to be assured that the federal process very much aligns with our process that we put in place already, and that in the robust discussion around the table that each of us in our respective jurisdictions would be satisfied and that our governments would be satisfied that things are handled in a way, one, that is evidence-based, meets our case definitions, are consistent, respects the privacy and the health and concerns of the individuals coming in. And they, too, probably want to make sure that they're not stigmatized or know that there's any issue, because if there's no need for it, then there isn't. But how do we handle that in a way that's sensitive, empathetic, timely? All those things have to be put in place. And I'm positive that we'll do that and trust the federal government to lead that process and to do that in consideration of our concerns, because that's part of the overall process.
When it comes to how it's spread, if you're on a, sorry, if you're on a crowded, I know it's not considered to be in the general population yet, and you're saying it's close familial contact, but would it spread potentially if you're on the subway and somebody has it and droplets get onto a surface and then you touch the surface? Like, can it be spread potentially that way? Is that how it might be spreading in China right now?
Well, Dr. Yaffe talked about even like regular influenza and other respiratory, all our messaging. And so I'll let you do the usual.
Well, I mean, just having come on the subway this morning, I know what you mean. People are close, and I think we get back to, first of all, the most important measure to prevent infection is regular hand washing. And I know that sounds really boring. Kind of is boring, but it's important. And if you hold something, touch something, try not to touch your face after. And I've actually had friends ask me, how do you not touch your face? Because you don't, once you think about it, you actually do touch your face quite a bit. So try not to do that. Wash your hands after you touch surfaces. And if you're coughing or sneezing, doing it into your elbow or a tissue and getting rid of that appropriately. And don't go to work. Don't go out if you're sick. So those are the most important things. Right now, we don't have any evidence of this infection spreading in Toronto or in Ontario. So those are the basic things that people need to do.
But it could potentially spread that way.
That's why we give all that messaging and get your flu shot. And I must say, Ontarians are known, and I think people are very careful with cough etiquette. Mm-hmm. I know the last press conference I touched my face. I was showing you an example. I didn't do it today. But I think that because you have a population that's aware and knowledgeable, mm-hmm. and I even watch some people with coughing. They're very concerned about what people are going to think, almost apprehensive, and that. I've seen people on public transit that get up and move away. So people are overly sensitized. I hope not being stigmatizing. But anyways, I think we're very tuned, and that's that knowledge, behavior, and stuff that we do in that regard. So
5 minutes.
I'm a little concerned about your cough, Dr. Williams. You
Thank you.
As far as please go get checked out. The flights are concerned. On Monday, you said there was no need to be dropping flights, to be blocking flights from China. Air Canada is just the latest. I mean, today they're stopping all flights, Beijing and Shanghai. Other airlines are following suit. What do you make of that move in terms of helping prevent the spread of the virus out of the epicenter?
Well, I'd like to know how they made the decision. Certainly our committee will be asking that. Was it an aspect of health concern? Was it staff concern? Schedules and flights? I don't know. But I would think that Health Canada and because it is a national carrier, would have been given some explanation. We hope to hear what's the rationale, because it does give a message. If that was already our position, that would make sense. So we haven't yet had a decision from the federal government that that's their decision on broadband cancellation of flights to and from China. So I'm not sure how they did that in consultation with federal authorities. And we haven't had much more communication. So I'm eager to find out. That maybe it's dropped off and it doesn't make it commercially worthwhile to have a half-load plane. I mean, there's economics there. It's a business. So they may have reasons. I assume we're going to be informed why and from federal counterparts.
Usually yesterday that it was because of the Global Affairs Canada recommendation against optional, non-essential travel.
Okay.
That was their justification.
Can you just clarify on the masks? Is there any role at all for them to play? I know when you go to the ER at any time, they advise you to wear a mask if you've got cough or fever. Is the advice just that a mask isn't going to prevent me from getting this illness, and if you have symptoms, probably just stay home anyway versus going out in public and wearing a mask? Or is the mask going to do anything if you are showing symptoms?
You want to do that one?
Sure.
Sure.
Thanks. If somebody's coughing symptomatic and they have to go out, either they have to get to healthcare provider for assessment, or for whatever reason they need food, whatever, it's an important thing, they have to go out, and they have symptoms, a mask can help prevent transmission. But in terms of, and obviously a healthcare worker who's doing an assessment of somebody who's ill, it's important that they wear protective equipment to protect, but then they wear a different kind of mask and different protective clothing. In general, though, for us, anybody who's feeling well, wearing a mask is not going to do anything. In fact, it might give them a false sense of security, because they start moving it and touching it, and they might infect themselves actually. So I know that some cultures it's a thing they do, and that's up to them. But it's certainly not going to help prevent them from getting infected.
And in the ER, when you're in hospitals, when you're wearing them, you're given strong direction from the infection prevention control leader. You can't wear the same mask all day. Mm-hmm. You have to keep changing them frequently, because they get moist and they build up your own bacteria in that, so you become more of a source of infection in that sense. So you're given strict guidance on how frequently you have to change them in that kind of process. And as Dr. Yaffe said, if you're going to switch to a more, one, you have to be fit tested, the whole aspect. So it's a different intensified approach overall. But if you wear the same thing all day long and hang around your neck sometimes and put on top of your head, I mean, it loses its functionality after that. Yes.
Of the 27 in cases that are under investigation, can you tell us where they are geographically? Are they all in Toronto, Ottawa? Whereabouts in the province are we talking about?
Well, we're not going to say location, and just to be clear, we don't call them cases under investigation. They're persons under investigation.
Mm-hmm. Where are these persons?
They're all over. So we're not going into location at this point.
Children under investigation?
I don't actually know.
Detail.
How many would be hospitalized out of the 27?
Most are not.
Most are not.
If other countries are considering people
Sorry,
without...
questions are only allowed from a... What's your yellow pass?
It's in my pocket.
Sorry, who are you
if
with?
other countries...
Sorry, we just try and keep really strict rules for the media gallery. Who are you with?
I'm with Reuters.
I know, right?
You're supposed to be over here.
If other countries are considering people without symptoms to be testing positive and they're considering them to be able to be contagious, why is Ontario not doing the same?
We're waiting to be advised from Health Canada on the international one. If we hear stories and we want to see why they're doing it, there may be rationale. Some are doing it. Is that the general overall direction of the science and evidence? So we're doing evidence-based. Some may be doing it for other reasons. We don't know. So again, when you're doing that, on the international panel, you have to give explanation and rationale to others why you're doing it. And because you're under review, because if others are doing it, what's the reason? What's the basis? What's the science? So we still go back to trying to have evidence-based. One can use precautionary, and one can get all sorts of levels. We would like to stick to what we do know rather than being fearful of what we don't know, and back that up with data and information. We ask the WHO, clarify the matter. Give us the data. If there is asymptomatic transmission, give us the examples, not just anecdotal stories. We need to hear the actual reports. Was it thoroughly investigated? And we're asking that. So it's not we're ruling it out, but give us actual case and information that's fully researched.
Are people getting over the virus?
Let's say I got infected by the coronavirus.
excuse me, what's the process, step by step, if you can explain it clearly, between the detection and the actual confirmation, the final confirmation of my case?
Maybe I answer both questions. I'll try and cover it. So let's say someone is exposed to the virus with close contact and someone there picks it up and they then incubate for a certain period. They are not deemed to be infected because it's not really grown that much. And then when they get symptomatic, then they come through symptoms and that can start to either cough it and sneeze it out or take their hands or mouth and touch things and stuff like that. At that time then, if we do the test, there's various tests, and the one we're doing is the PCR. That's the test we're doing. It detects particles or fragments of the virus. When they do that, then they say, okay, do you have evidence that you have or had been exposed to this virus? Is it in your nasal pharyngeal passage when we do the swab? And the test will tell us that. What we're finding is some people, young people, get it and recover fairly quickly. But meanwhile, they could have little bits of the virus still left in. Does it mean that the virus is viable? Probably not. So that can carry for a certain period of time until they clear the whole system out. We're trying to understand how long is that, ask our scientists that question for this particular virus. So people do recover spontaneously. We're probably going to find from China most do. And some, especially younger people, have a fairly short-lived mild infection and throw it off fairly quickly. So most of the ones we're going to find, a lot of them did not get ill enough, as we're seeing here. A lot of our people under investigation are not admitted to hospital. They're in home.
Clarify, like, are there people that have gotten the virus that are now clear, as you say, that don't have the virus in their system any longer?
They could be.
But you don't know necessarily if they still have any.
We would have to have someone identified, and that's what we're trying to do with our. We'd like to carry that through the process to say, if it's like other viruses, we know they clear after a certain period of time. And we could always test them to see, and that's what we're hoping to do. If we have a case, when do we say they're clear? And we're asking our scientists that question now.
You don't have that answer yet.
Well, we haven't had it long enough to follow someone. So we're going to try and answer that question. The knowledge is that they will clear.
We're operating under the assumption that all of the 27 or every person under investigation has flown back from China or has been to Wuhan, right? So at what point then do you start looking at all of the flights that they were on to start looking at the radius around them? Is it only once they're confirmed or once they're under investigation that you start broadening out and reaching out to other passengers on other flights?
Well, because these people came in asymptomatic and developed it after being in Canada, there's no evidence that they were sick on the plane. If we find out the history and said, oh, you actually were sick on the plane, then we'd have to look at it differently. So far, we have not had that information. So all the flights, remember, we have no direct flights ever from Wuhan to Canada, but indirectly, and they give a travel history. They have all that in similar aspect there. So we would only investigate other ones on the flight if we felt someone was quite ill, or was ill on the flight in that time. But so far, we have not heard that from these others, except this couple.
Okay, thanks everyone. No, thanks everyone.
Thank you.
Yeah.